Good communication. How can you improve your communication? First, you must understand your communication style. Do people frequently misunderstand you? Do you have an accent? Do you use a lot of slang? Do you overtalk with big words? This is very common in healthcare. Pay attention to your body language. Have you learned about cultural competence? How does your patient receive your communication style? Does your patient follow your instructions the first time, or do you find yourself repeating yourself frequently? How to be more efficient with your communication. Speak simply and clearly. Use a calm voice and be patient. Always face the person and use appropriate personal space. If it's culturally appropriate, give good eye contact. Avoid medical jargon and slang. Try to be at the same level as the person. Don't tower over them. Don't talk across the room. And make sure that the client has their glasses and hearing devices on and that the lighting is good. Find out how the client communicates best. Eliminate distractions like noise or television. Make certain that basic needs are met, like hunger, toileting, and sleep. The goal to communication is that the client understands you. Break the task or any instructions into sections. Draw pictures if appropriate and use visuals. Pause frequently and seek clarification that they understand by asking them to repeat back or show you what you mean. Don't accept a yes or no answer. Make certain that the person has your communication device, such as their glasses or their hearing aids. Don't talk louder, but speak slower and clearly. Don't use unnecessary words. Don't talk across the room while moving. Establish routines in communication. If the person is best in the morning, have your important conversations then. Always give the patient time to answer. This can be challenging for a caregiver. If you want to make your communication more accurate and complete, try being a good listener. Provide feedback as you listen. Bring up topics of concern. Allow pauses to happen. Don't try to fill every empty space with sound. Tune into other cultures and ask for more. When developing good interpersonal relationships, avoid changing the subject when your client is discussing something. Don't ignore a client's request. Don't talk down to an elderly, disabled person or child. Sit near the person who started the conversation. Lean forward in your chair when someone is speaking to you. Approach the person who's talking and put yourself in other people's shoes. It's important not to change the subject when your client is saying something. This is true, even if it makes you feel uncomfortable and helpless. For example, if the client says, "I'm having so much pain today," do not avoid the topic because there is nothing you can do, as this will make the client feel that you're not interested in him or what he's talking about. Instead, say, "Is there anything I can do to help you?" This makes the patient feel heard and gives them the opportunity to ask for assistance. Never ignore a client's request, as this would be considered negligent behavior. If you can, honor the request. If you're unable to honor the request, explain why. Always report requests that cannot be honored to your supervisor. Sometimes a change in the care plan can meet the client's needs. Never talk down to an elderly, disabled person, or child. Always speak to your clients and their families the way you normally talk to people. If needed, you can make some adjustments if someone is hearing impaired or visually impaired. Sitting near a person shows that you find what they're saying important and worth listening to. Likewise, if you lean forward in your chair when someone is speaking to you, it shows them that you are interested in what they have to say. Approaching the person who is talking also tells the person they are interested in what they have to say and are actively listening. Pay attention to your body language. If you cross your legs and fold your arms, it sends a message that you're closed off and you're trying to distance yourself from the speaker. Empathy means that you're trying to understand what another person is going through. Put yourself in your client's shoes. Imagine how it would feel to be confined in bed or require assistance with bathing and dressing. Don't tell your clients that you know how they feel, because you don't. You haven't lived their life. Instead, say things like, "I can imagine that this must be difficult for you."